Hi everyone. Gosh, it's been a long time since I've done one of these updates, but there's so much I want to share with you. So I'm calling this the good, the bad, and the ugly. So let's start off with the good. The good, as some of you may know, I randomly met 6 months ago on the Eurostar Simon Sinek, who's a very famous best-selling author, inspirational speaker, and podcast host. And as a result of that encounter, I've been invited to create an online course called Mastering the Skill of Asking for Help. And the news is it's just gone live on his online learning platform. And they're now going to be promoting it to their 4 million followers. And I host my first online class and workshop in April. So it's just a remarkable, wonderful step change in this gift of help journey of mine and a huge confidence boost. And that takes me on to the bad. The bad is really just my ongoing battle with recovery from the chemotherapy and the immunotherapy treatment, the constant battle with fatigue and energy and a compromised immune system. Each morning, I just don't know if I'm going to wake up with a 2 out of 10 or a 7 out of 10, a full fuel tank or an empty one. And that's really tough in terms of just micromanaging my day and my commitments and plans, what I have to cancel or what I can stick to. It's mentally exhausting. And yeah, there are mornings I can wake up where I'm feeling incredibly low, demotivated, fatigued, and therefore quite depressed. And yeah, it's tough. And it feels also the battle my body's having to go through to fight also these wonderful winter bugs and viruses that are going around that I seem to pick up more often than most. Just means, yeah, this is not an easy time, and trying to practice the acceptance and patience. But the added frustration of having my specialists tell me that I'm actually medically recovered, and actually from all the tests they've done, the blood markers, my heart rate, my blood pressure, my cholesterol and everything, they tell me actually I'm an incredibly healthy human being. But gosh, sometimes I don't feel like that. And actually also their revelation, which I wasn't aware of, and I'm amazed that it's not such a well-known syndrome, that 35% of patients 1 year after chemotherapy suffer from cancer-related fatigue. So I realize I'm not alone, but of course there's the stubborn side of me that wants to be the 65%, not the 35%. And then that takes me on to the ugly. And that's just my observation and experience of the health insurance system. It's just quite remarkable how it's wired to be mostly around prevention rather than cure. I'm proud of myself where I took the proactive step about a year ago to get the psychological help and therapy to support me through this really tough period of just accepting who I am and the state of my recovery and my health and the uncertainty around that and what the future holds. But yet the hoops that you've got to jump through and the time you've got to spend on the phone to your health insurance company to just ensure you're going to get cover for this really important treatment, which is all going to help me, hopefully, with my recovery, is just remarkable. It baffles me. But yeah, I'm trying to get more and more resilient to this frustration, and in general take the step back and look at the bigger picture and the amazing life lessons that I'm learning through this whole experience, which I'm sure is going to equip me super well and serve me in the future. And the excitement and optimism that I have for this Gift of Help initiative really helps. And I'm increasingly feeling confident that this is going to be where I want to dedicate my time and my energy, and will become my livelihood, to transform us from a world of help rejectors to help receivers. So I'll keep you posted on that journey, and I'll leave you and wish you and hope for you to be in a happy and healthy world, and hope that there's things in your life that are serving you as much as they're serving me. And I'll leave you with my mantra, which is, by helping yourself, here helping each other. Okay, take care, and we'll be in touch again soon. Okay, ciao for now.